Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. This brings a rare combination of clinical depth, lifestyle-focused care, and a deep commitment to patient partnership. Dr. Tatiana Pestana is a board-certified internal medicine and pediatric physician, a certified functional medicine practitioner, and the founder of Pestana Comprehensive Wellness, a cash-based integrative practice focused on uncovering root causes and delivering truly personalized care. With decades of experience across both hospital and outpatient settings, Dr. Pestana blends evidence-based diagnostics with compassionate listening and functional tools that support lasting transformation. She holds an MD from Albany Medical College, an MPH in maternal and child health from Tulane, and is also a certified culinary medicine specialist, merging nutrition and science in meaningful, practical ways. In her practice, Dr. Pestana emphasizes time, trust, and transformation, offering advanced testing, hormone and metabolic support, GLP-1 therapies, nutritional counseling, and more, all within a model that prioritizes healing over volume. Her clinical focus includes cardiometabolic health, hormone optimization, pediatric wellness, and complex chronic illnesses, all delivered in a safe, inclusive environment for families and individuals alike. This is a conversation about redefining care, rebuilding trust, and returning medicine to its roots. Let's dive in and welcome Dr. Pestana to the show. How are you today, Doc?
I'm great. Thank you. Thank you for having me.
I'm so excited because, as I shared with you before we came onto the podcast, you are local here, close to my South Florida office. I have nationwide support for my clinicians. So I have offices in Las Vegas and here in South Florida. And I noticed that your office is very close to mine. And I was like, I want her on the show. She's local. And I will just say this for the record. I'm shopping, if you will, for a functional medicine doctor. So I was like, hey, what better than to find somebody, have them on the podcast, and then they can be my doctor.
Fabulous. I like the idea.
And what's really cool that I don't think I've had on this podcast yet is a pediatrician, so someone that does pediatrics. There are so few doctors in the functional space that are doing anything to do with pediatrics. So you must be getting a ton of pediatric business, I would assume. If you're not, you will after this podcast. But anyway, that's super cool that you do pediatrics as well, because, I meet with, when I meet pediatricians, I'm like, oh, have you looked into functional medicine? And they're like, oh, not yet. And I'm like, you should, because boy, what a difference that could make if we started, doing functional medicine when they're pediatrics, right? And starting at that age, what a difference that would make
for sure. Yeah.
Right? So tell us a little bit, if you don't mind, about your background, what led you to functional and integrative medicine and how did you get here?
So I've been practicing traditional conventional medicine for just over 21 years now. And I think it's been evolving over time. I first started getting into lifestyle-based interventions when I got my certification in culinary medicine, and I started to see firsthand really what a difference we can make when we change our diet and we just start moving. And the way that the labs change was just eye-opening to me. So that kind of opened the door. And then I began my certification in functional medicine. It kind of takes it all together. It takes my conventional medicine experience, my nutritional experience, and then I add in all of this scientific depth from functional medicine, and it just creates this great evidence-based, in-depth sort of way to practice that I think is really rewarding.
And how many years ago I know you got into the culinary thing, and then, so how many years have you actually been doing the functional medicine stuff in your practice?
I started my certification in 2021, and that's when I started peppering things into my conventional practice. So even a lot of my previous primary care patients would say, I don't think you were actually practicing regular primary care for quite a while. So probably about 4 years now.
That's great. That's great. And so you're fully 100% now all in on the functional, right? You're not doing any
All in.
primary
No
care anymore.
primary care. No primary care, just all functional medicine for sure.
That's awesome. I'm so happy for you and happy for your patients because I know how many lives you're changing. Has this influenced your personal approach to health and wellness at all?
Well, I definitely think it makes it so much more important for us to practice what we preach. I think that, again, in conventional medicine, we see a lot of, okay, you need to do this and you need to do that, but then your physician may not get a good night's sleep, or they may not be eating well. They're just grabbing Burger King on the way to the office. And so I think that this has taught me that if we're not practicing what we preach, how can we expect our patients to prioritize those things? I definitely take a little bit from everything that I learn and bring it home to my family, which sometimes is really welcome. And sometimes they're a little frustrated with mom and the things that I say about the foods they bring home, but it's okay.
Right.
It has changed the way my family experiences health.
And it's progress. It's not perfection, right? I mean,
For sure. My son, he was diagnosed with juvenile rheumatoid arthritis. And one of the first things that we did was try and go gluten-free and dairy-free. And it didn't stick 100%, but it definitely changed what we keep in the house on a regular basis. And I know I don't necessarily need gluten, although my kids would argue quite a bit with that. But there's so many great alternatives out there. So
And how is your son doing today?
he's doing great. He's in remission. He's off all medications. We definitely feel like the lifestyle changes that we made an impact.
Well, 100% for sure.
Mhm.
Are you working with other pediatric children that suffer from JIA?
Not currently. I mean, the majority of my pediatric patients right now are really trying to optimize nutrition for being, let's say, sporty kids.
Okay.
So kids whose parents are concerned about, what they put in their body to optimize their athleticism. I also have kids who are really just trying to get to a healthy BMI. And then I have some other kids who are really trying to optimize their diet for immunity purposes. It's a little bit of a gamut there.
Are you open to working with kids that have arthritis? Okay.
Absolutely.
And more chronic.
Absolutely.
Okay, good. I just want to put that out there because although the podcast is for other practitioners, this also does reach, the layman and the regular public. So I always like to, if I can let the general public know, hey, there is a physician here in South Florida. If your child has juvenile arthritis, that can help you. So, just reach out to you.
And full disclosure, because of my conventional background, like one of the things that I feel is very not quite functional medicine for me is I feel like I can really recognize when a child or an adult is going to benefit from the medications as opposed to just lifestyle interventions.
Thank you for sharing that because, I work with a clinician for over 5 years now, and he specializes in autoimmune, and they have worked. And sometimes, the kids are already on an immune suppressant. And so he has to work very, with the endocrinologist or with the rheumatologist. Thank you. He has to work very carefully with those doctors. It's not just about taking the kid off the medication and, changing the food. It's about those two clinicians working in conjunction. And then that clinician that's got the child on the medications, once you or the other, provider can get the kid to the place where then they can start to taper off and be taken off those medications. Sure. All right. So let's talk about, can you share a story with us of a patient? I'm sure there's lots of them, but one that maybe sticks out to you that live was significantly improved using functional or integrative approach?
Yeah, so I have a woman, she helped me quite a bit throughout my certification, just because she was my multisystemic patient.
Okay.
And so she had a multitude of symptoms, GI symptoms, musculoskeletal symptoms, brain fog. And really, she came to me with a whole bunch of labs, a whole bunch of imaging from multiple doctors that she had seen over the course of many years. And really, it's challenging to be able to take all of that information all at once, but we were able to step back and look at it all. And we were able to make a lot of changes dietary wise, some habit changes, some evaluations that were really very pivotal in finding out what she needed to avoid to have less symptoms. There was no miracle cure. It was really just understanding why certain things were happening, that she was able to make some very lasting changes in her diet, in her use of antibiotics. And we were actually, once we took that step back, we were able to find way back in her history that she had had a CT scan that showed that she had an atrophic pancreas, but none of her other physicians had ever checked to see what her pancreatic function was like. So really, it was one simple step, just attributable to us being able to spend the time together, that we were able to diagnose pancreatic insufficiency. And just giving enzymes was really very helpful in her symptoms. One of the major symptoms that she came to me for was significantly improved. It's the time, it's the putting the dots together, putting the pieces of the puzzle together that really made a difference. Not necessarily that I did anything all that functional, actually.
Yeah. No, and I find that a lot of the clinicians share that on this podcast, that, it's about the time, and everyone's unique, and you got to take the time, and everyone, you have to treat differently, and there's no one size fits all type of, regimen that anyone's prescribing. And that makes perfect sense. So that's awesome. Taking the time to find out something that would sound simple, but if you didn't take the time to figure it out, you could have spent years throwing medications at it, trying different things, and never really finding out the root cause. So that's a great, simple way of showing how cool this type of medicine is.
Absolutely.
Let's talk about the not so fun part, if you don't mind, because a lot of docs that are listening to this show, or clinicians, they want to do this business, but they're on the insurance model, and this is how they pay their bills, and how do I transition, and how do I do only cash pay? So, I'm sure adopting this new approach has brought challenges for you, especially since it's within the last 5 years. What challenges do you remember, and how did you navigate those?
So yeah, it's very challenging to go from a model where your patients are coming to you automatically. They don't know you, they don't know anything about you, and their insurance tells you this is your primary care doctor. And those people luck out when they meet you, but really you didn't have to advertise, you didn't have to do anything. Going to a cash-based model really is much more challenging because you have to show people what it is that is different about you. And you have to be able to educate them on what integrative and functional medicine is. A lot of people hear those words, they don't really know what it means. They don't know what the difference between that and primary care is. So it's hard for people to see what the value is. As a physician, you basically go into your exam room and you spend it there with your patients, and you feel like this is what I'm supposed to be doing all day. But when you transition to this type of model, you really also have to let people know that you're here, and that becomes more salesy.
More marketing.
So
Yep.
yeah, and can become uncomfortable for physicians who, a lot of us are introverts.
Yep. Do more networking, do
Yes.
more social interactions, do more videos, doing all those things that, yeah, you doctors by nature tend to be educated, introverted type personalities, that really don't want to be the limelight, or in the limelight, or in the, on the video, right? But yeah, when you become this type of medicine, you have to put yourself out there a little bit more, because they're not just going to come to you, like you said. So
Absolutely.
that's
Yeah.
great advice. And then what do you wish someone had told you when you first started practicing this way?
To have a an easy way to explain what it is that functional medicine is, because I really, even to this day, I have a hard time explaining it. I know that root cause medicine is, the catchphrase, and holistic medicine is another catchphrase, but I really don't feel like it resonates with people, but I don't really feel like I know that both of those terms are true. I usually try to think about it as more like systems based and data driven and a multi-system interconnection, but I can't really say that in a really good sentence that helps people understand what it is that I am trying to explain. I don't even think I explained it very well just now. So knowing how to explain how this is different is really, really challenging. Financially challenging, at first, knowing that you should probably have a little bit of a cushion at the beginning, just because it takes a while for you to be able to explain what it is that you do that is different and what the value to that is. So that's not usually fun to talk about, but I think it's something to think about if someone is thinking about that transition. But it really is so worth it. Every time I go to work and I know that I have the amount of time that I need to spend with a patient, and nobody's going to rush me, and I don't have to run to the hospital, and I don't have to add on a sick patient, and I have that time dedicated to that patient to work out what it is that we are trying to achieve, it's incredibly rewarding, and it makes me happy to go to work every day. So it's really rewarding if you're able to make that transition and you can get through those little spots of discomfort.
Yes. And if you follow my podcast, you will see a theme that runs throughout all of the interviews that I've done, which is that my doctors on this podcast are very happy and they enjoy what they're doing and they have balance and they are able to spend time with their families and they're not burnt out and all of those wonderful things. So I would just say, coming back to that original question about, explaining what you do, one of the things that's kind of, I think, as a layman resonated for me is that after speaking to all of you guys for the last 6 months, is that this is much more scientific based medicine. So for example, a traditional doctor is going to look at, and again, I'm a layman, so I don't know the correct terminology, but I'm going to just throw this out. A traditional doctor is going to look at, 10 or 20 biomarkers. A functional medicine doctor is going to look at 100 or 150 different biomarkers. So it's a much more scientific based medicine is one of the things that I've learned from you all. And I think people think it's the reverse. People think that traditional medicine is more scientific, but it's actually not.
That's one of the things that I feel a little sad about, actually, because you may see on social media that people talk about root cause medicine as being less scientific, but the grand majority who practice this, they've gone to medical school or naturopathic school, and then they did more training and they did more stuff. So it's adding on to this knowledge base that they already had, and they just apply it more precisely.
And I will say it's the MDs and the DOs that are the ones that are saying it's more scientific. So when it's and one of them, she worked in the NICU for 30 years, trauma doc in the NICU for 30 years, told me that this is more scientific. So it's the Rolls Royces of doctors that have worked in the most high level scientific type of medicine that are telling me this. So I know that they're right. We need traditional medicine. We're always going to need traditional medicine. We need that acute care. If you're sick or you cut your arm off, you need those doctors. This is, it's nothing against traditional medicine. This only enhances traditional medicine. And what I say is, if you find an MD that's also doing functional and integrative medicine, you found the Ferrari of the doctor. That's all. It doesn't make, it's just, you're just the souped up model, right? You come with all, you've got all the bells and whistles. That's all. So what advice would you give to other MDs that are thinking about adopting this approach to medicine, but are kind of like, oh, I'm not sure. I don't know. I don't know if I should do it. All my friends are doing it, but I don't know if I should. What would your advice be to them?
I would say just start getting educated, because really the moment you start going to those lectures, the amount of interest that it piques inside of you, it's really overwhelming. Starting with culinary medicine, we were very focused on the nutrition, the recipes, how we get patients into the kitchen. Then as I started the functional medicine coursework, and we were reviewing the biochemistry and reviewing all of the more complicated lab testing, bringing that back to all of the nutrition I learned was like, it was mind blowing. I said, I just knew that I had to keep going because it was so interesting to me and it was so inspiring to help people to prevent stuff, not just to wait until they got into my office and now I have to treat a problem. And again, even with my primary care patients, I would start talking about pre-diabetes well before their hemoglobin A1C was elevated.
Right.
So it's really just a way to nip things in the bud and be knowledgeable and it's just inspiring.
Docs by nature tend to love to educate themselves, right? But like you said, I think in the beginning, or it was you or one of the other docs shared, in the old days, you just go to these CME classes and you're like dreading it, like, oh God, I got to go to this CME class. This is not that. This is inspiring. It's making you think outside of the box. It's just opening up a whole different world, right?
Absolutely.
So speaking on to that, there's so many trends going on right now. Like, what is one of the things that you're kind of excited about that you're looking at coming down the pike? Is it the peptides? Is it the red light therapy? Like, what is some of the things that you're kind of like, oh, this looks cool, I'm going to look into that more?
Well, I am excited about peptides. I mean, I found some topical peptides that I love for myself, but
Oh, good.
we digress. Really, I'm mostly excited about the testing availability. So I love the fact that we have advanced lipid panel testing with inflammation, HOMA-IR, ways that we can be preventative about cardiometabolic evaluation well before we're talking about plaque and well before we're talking about heart attacks and symptoms. I love being able to do that little calculation for insulin resistance and show people how their body is becoming a diabetic before we even see an elevated sugar. I love that. I am also super excited about the evolutions in hormone replacement understandings right now, just because we are just starting to understand how our previous studies were not necessarily as black and white as what we thought. That is absolutely fantastic for perimenopausal and menopausal women, their cardiometabolic health, their emotional and physical health in every single way. So I'm super excited about that. And then bioage testing. Biological aging is something so incredible. It tells you what your age is right now, and then we can repeat it 6 months, 12 months, and see how our interventions have made a difference in your biological age. A lot of my patients are really, really data driven. So they want to see the results of those efforts.
So if there's one message you want listeners to take away about functional and integrative medicine, what would it be?
That it is something that is very scientific, that it is something very personalized. It is not about finding that one supplement that's going to fix everything. It is not finding one root cause. I mean, root cause is really about finding the interactions between systems. It's not about finding one root cause that is causing all of your problems. That is much more simplistic than what a functional medicine doctor is doing. So try and separate what the wellness influencer industry is doing and what functional medicine actually does for a patient.
I love that. And I love that you shared that it's not one root cause, because there's a lot of root causes. So there might be an underlying root cause that's causing weight gain, but you've got an underlying root cause that's causing other issues, psoriasis or whatever. So there can be multiple root causes that are causing different issues. There's not just one thing that handles everything.
Sure. And it's important to take into account how those two things are influencing each other. A lot of times we're, particularly, and not to knock conventional medicine, but we're going to take care of your psoriasis in this place, and we're going to take care of your weight in another place. And those two hands never meet each other. So I just think it's super important that we understand that everything that goes on in our body is influencing another thing.
And it's interconnected. So when you're working with a functional medicine doctor, they're looking at how are those interplaying and interconnecting together.
Absolutely.
Not as two separate entities, right?
Exactly.
We're treating the whole person.
Yes.
I love it. And then what is the best way to reach you, Doc, if other physicians want to reach out and have any questions, or also layman people like me that might be looking for a functional medicine doctor in South Florida? What's the best way to reach you?
So my website, PestanaWellness.com. And there is a way to schedule a call with me to see if we jibe, if what you are looking for is actually what I am offering. There's also obviously an explanation of what it is that I do. And then you can always call the office. It's 954-755-8844. So multiple different ways for people to be able to schedule conveniently.
It sounds great. And I'm going to be reaching out because you're local to me and I need a good functional doctor. And I am very interested in that bio-age thing that you just talked about, because I would love to know my bio-age. What did you call it? Bio-age? Is that
bio-age? Yes.
I want the bio-age thing. So I'll be in touch with you soon. But thank you so much for taking time out of your busy clinic today to be on the podcast. Really appreciate it.
Thank you so much.
Have a great day.
Thank you for having me. It was an honor. Thanks.